Hello everyone. Today we are going to see about complement system pathway. In complement system there are three pathways: the classical, the alternative as well as the lectin pathway. The complement system may sound like a sidekick, but in reality it's your immune system's secret weapon. It tags, signals and finally blows holes in the microbes with a deadly membrane attack complex. So how does it do it? What are the pathways through which it can do it? The complement proteins are acute phase proteins that are produced by the liver. It can trigger the classical pathway or the alternate pathway or the lectin pathway. What is classical? The complement will get activated when this classical pathway gets activated when the C1 binds to the Fc region of the IgG or the IgM. Here we have the IgM antibody. Once the antigen or the microbe is attached to the FAB region, the complement is attached to the Fc region and it gets activated, finally resulting in membrane attack complexes. That is the classical pathway. What is alternate pathway? This is triggered by C3b. What does C3b do? It binds the microbes. It opsonizes it. That is, it coats the microbes or the pathogens for destruction by the phagocytes. So how do you remember that C3b does this? What is the difference between alternate as well as the classical pathway? The difference is that in classical pathway, it needs an antibody to bring out the complement activation. While in alternate pathway, the C3b alone can attach with the microbe and it can bring about the alternate pathway. So how do you remember that C3b is the one which is responsible for the alternate pathway? There is a mnemonic. C3b's, that is 3b, it will bind, it will boost and it will burst by formation of membrane attack complex. The mannose binding lectin, it is another pathway. The mannose binding lectin, that is a part of the innate immunity which circulates in the blood. This pattern will recognize the receptor. How? The receptor of what? This pattern recognition receptor is the mannose binding lectin. It will recognize the unusual sugar patterns on the microbial surfaces, because the unusual sugar will be a mannose residue on the pathogen. The mannose binding lectin will bind with the mannose on the pathogen. It initiates the lectin pathway, providing immediate immune response without requiring prior antigen exposure or antibody production. All three pathways will converge to membrane attack complex formation. The membrane attack complex is important but not always necessary. For most microbes, membrane attack complex is not always necessary, except for some like Neisseria, where it definitely needs the MAC, membrane attack complex, for its destruction. What about the opsonins? Opsonins are the cellular tags. That is, it will coat the microbes, making them recognizable and appetizing to the phagocytes. So it will coat it in such a way that the phagocytes can recognize the microbe very much. So what is an opsonin? The opsonins are C3b as well as the IgG. Apart from activating the alternate pathway in the complement system, C3b also acts as an opsonin. IgG antibody also acts as an opsonin, apart from being a part of the antibodies. Once the opsonins are coated, what will phagocytose them? Meet the phagocytes. It will be phagocytosed either by the neutrophils or else by the macrophages. So even though IgM and IgG can attach with the complement and trigger the complement classical pathway, the complement, the opsonization is done only by IgG. The opsonization is done by IgG and C3b, while the IgM is good in complement activation, activating the classical pathway, but it has no opsonization capability. In short, the C3b has a dual role. It activates the complement and also it causes opsonization. What happens in post-streptococcal glomerulonephritis? It is a streptococcal infection where it leads to the formation of immune complexes containing streptococcal antigens. These immune complexes gets trapped in the glomeruli of the kidneys, triggering local inflammation. The body will attempt to clear the immune complex by activating the alternate pathway, thereby consuming major amount of C3. Finally, it will result in low serum C3 and normal serum C4. This is the hallmark for distinguishing PSGN. In cryoglobulinemia, exactly the same happens. That is, there is immune complex formation. And the classical complement pathway is triggered such that it will result in low C4. But the C3 may or may not be low. In PSGN, the alternate pathway is triggered and it leads to a direct C3 consumption resulting in low C3. What are the complement deficiencies and clinical correlations? We have a condition known as CE1 esterase inhibitor, which causes hereditary angioedema and resulting in facial puffing through uncontrolled complement activation and increased vascular permeability. When there is mast cell degranulation, C3a, C4a and C5a will potentially cause anaphylaxis-like reactions. C5 to C9 defects will predispose to recurrent Neisseria infections due to its inability to form effective membrane attack complex. What about paroxysmal nocturnal hemoglobinuria? This is the picture of the RBC. The GPI will anchor the RBC to the CD55 and CD59. They cannot attach to the RBC by itself. It needs this GPI anchor. What is the gene that codes for GPI anchor? That is the PIGA gene. When there is a PIGA gene mutation, there is a defective GPI anchor. CD55 and CD59 cannot attach to the RBC surface. Therefore, the RBCs become vulnerable to destruction mediated by complements, resulting in hemolysis, especially at the night. You can imagine the CD55 and CD59 as an armor for our RBCs. When that is not there, then it is attacked by our own body's complement, resulting in lysis. Why does the attack on the RBCs happens in the night? Because during sleep, ventilation naturally decreases, leading to mild carbon dioxide accumulation. The mild elevation of the carbon dioxide results in mild acidosis, creating a slightly acidic environment through carbonic acid formation. The acidic environment will favor the complements, thereby resulting in hemoglobinuria in the night. Morning, they will be having hemoglobinuria. The patients will discover dark urine upon waking, reflecting the overnight intravascular hemolysis. With this, we have come to the end of our complement presentation. I hope I have made certain points very clear to you. I have an announcement. I am starting my mentoring lessons for medical graduates and USMLE aspirants. If you like my videos and want to get mentored by me, you can send me a message in the comments. Thank you. All the best for your exams.